Spring is also here. Summer's coming, and you know how this goes. You start wearing lighter clothes, less clothing, and your body's talking to you saying, wait a minute, I might not be ready for this.
Something like CoolSculpting or Ultrashape could help you get ready. The big draw with both, neither procedure is invasive.
Yeah, which makes you think, how do they work? Well, Dr. Joel Schlessinger is here to explain. Good morning, Doctor. How are you?
Nice to have you here.
Good morning. Great to be here.
So let's talk about these. There's a couple procedures. Who are good candidates for them?
Well, generally speaking, CoolSculpting is going to be good for people who are about 10% to 15% over their goal weight. And Ultrashape is going to be good for people who are about 5 to 10% over their goal weight.
And we have some pictures to show, because this to me is where you really pay attention when you can see what difference is made. This is with...
That's with Ultrashape.
Okay.
And so what you can see is that this individual had a very small amount left to go, and they just had dieted and exercised to the point where they had no more left to go, and they just couldn't get there. So this is one treatment after it, and you can see it makes a very nice difference. Now, Ultrashape is 3 treatments, and Ultrashape is ultrasound used to destroy the fat, whereas CoolSculpting, as the name would say, is cool or freezing to freeze the fat off.
So you're not using knives. You're not using scalpels.
Zero invasive.
No needles.
Wow.
Nothing.
Yeah,
So
nothing.
then there's not is there a recovery time after these procedures?
Not really. I mean, people go out and about and they do what they need to do. Now, the one big proviso is that if you're a little over that, if you're over 15%, if you just need a little bit more, maybe you will need liposuction, and we can do smart lipo if that's the case. The nice thing about that is that we have all the techniques available, whether you need to go with the tumescent method, whether you need to want to go with something that is non-invasive. Now, of course, everybody would prefer to go with the non-invasive, and we would too, because it's so much simpler. People can go out and about and on their way. And there are so many options available, whether it's these non-invasive things that people can go and do what they have to do and not have any downtime. I mean, zero downtime.
You could almost go to the pool.
Absolutely.
Like the same
Right
week
afterwards,
that you had something
Right.
done.
As you saw in the last picture, men are also candidates for this.
Look at that difference.
What areas can be treated?
Well, in the men, it's the flanks. I mean, it's those love handles that men really, really love to have treated. And also the chin. I will tell you, the CoolSculpting has come out with Cool Mini. So Cool Mini is for the chin, and that is phenomenal. So it's 2 treatments, 1 or 2 treatments, and you go away, you have almost zero perceptible change, i.e. no swelling, and you can go out and about and do your thing. And unlike Kybella, which does have a little swelling, and we do Kybella too, Cool Mini is great. Now, Cool Mini is great for somebody who has a little area. The Kybella is probably a little bit better for somebody who has a little bit larger, more diffuse area, but it can be variable. Some people are better candidates for one versus the other, so it's great. So we have chins, we have flanks, we have tummies, thighs, you name it, we got it covered.
Well, yeah, because you were just focusing about men, but I'm thinking about the pictures we saw of the women where it was like those areas where, sure, you've tried to lose weight, but they're not moving.
In fact, it's really great for those people who've done everything but just have a little bit left to go. I think that the big thing that people sometimes forget is that if they try, if they really do their best and they have a little bit left, they're actually the easiest people for us to take care of now versus when they weren't. That's actually putting on the CoolSculpting transducer. So it sucks the fat into there, then it chills it for approximately 35 minutes to an hour. You take it off and you go on your way. The amazing thing is that the CoolSculpting treatment, something that has been here for ages. I mean, how long have we had freezing? And we could have been doing this for like, you know, 100 years, but they had to figure out that it actually worked.
Once you freeze the fat, does it stay? I mean, like those results stay forever?
Oh,
or do
absolutely.
You have to go back every other year or something to have it maintained?
What's done is done. That fat is gone.
That's awesome.
Gone, baby,
And
gone.
Right, it's gone. But it looks so much easier than liposuction. Is it a better procedure than liposuction? How does it compare to lipo?
Well, you know, it's a good question. You know, I sometimes do liposuction on people who are over 15 to 20% over their goal weight. And, you know, keep in mind, you got to do liposuction on people who have a ton of weight to lose. But if you're in that 15 to 25% range, liposuction is probably a better procedure for you. If you're in that 10 to 15 range, probably it's going to be CoolSculpting. And if you're in that 5 to 15%, probably it's going to be Ultrashape. So there are so many new treatments, and it's so easy to do, and we can do larger areas. So it's great to have these options and have everything available for people, and really to get people ready for the summer.
I have to imagine a lot of people watching are interested in what you've shared today, and he sweetened the deal a little bit here. A $50 gift card to LovelySkin when you have a procedure done, either CoolSculpting or Ultrashape. So let's show you the phone number to call and get that consultation, because it does sound like everybody's going to be different. It depends on what are your needs, what are your goals, and then they can talk to you about the treatment that'll make the most sense. And the number to call to get that started, it's 402-334-7546. And then online to learn specifically about CoolSculpting, the site is lovelyskin.com/CoolSculpting.
And Doctor, the non-invasive nature of both of these procedures has to be so appealing to so many people out there who maybe wouldn't think about any other procedures like this.
Absolutely. And one other thing, I think that it's important to note that for men, a lot of the times it's the male breast area. So there are a lot of times
Works
that we
for
do.
that too.
It is so great for that area, because there are so many times that people come in, I don't want to wear my shirt, I don't want to go golfing because the shirt shows that. So men, women, it is great for both those areas. And this is, by the way, the time to get in. It is a perfect time to get the fat treated.
Before the pools are open.
Absolutely.
Doc, thank
Thanks,
you.
Doctor.
Thank
Good
you.
to see you.
Always
Guess
good
of the
to
Morning
see you.
Blend start there.